You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations, especially today, because our topic is Advanced Directives, the Living Will, Healthcare Power of Attorney, and Do Not Resuscitate. And our expert guest today is Joanne Didion from Stein Hospice. Thanks for being here.
Thank you.
Talk a little bit about what you do at Stein Hospice, your credentials and all that kind of stuff.
I am a licensed independent social worker. I've been working with patients and families in the field of healthcare for over 15 years now, and working in healthcare situations that would warrant an advanced directive.
Okay. I saw a sign once that said, doctors practice medicine and dancers dance and social workers do what needs to be done.
That's right.
Is that about right? So we kind of...
Other duties as assigned.
As assigned, that's our specialty. And one of them is advanced directives. So just kind of list, when somebody says advanced directives, what does that mean?
Yeah, oftentimes I talk to people and I say, do you have advanced directives? And they say, oh yes, I have my will, it's all taken care of. Well, advanced directives is not your will. Advanced directives is your healthcare power of attorney, naming someone to make medical decisions for you. It's a living will, which is a document that states what you would want done if you were in a permanent vegetative state.
Okay.
And then there's also, in the state of Ohio, a DNR, which is a Do Not Resuscitate order, which comes from your physician, and you have 3 choices as far as DNRs go.
Okay. So I hear the same thing sometimes when I talk to people of, oh, I've got my will all taken care of, and so-and-so will help me with my finances if I can't do it, but that's different stuff. This is all about healthcare specific when somebody says advanced directives. And the reason I asked you to be on the show, we had a presentation over at the hospital actually on advanced directives for staff, and it was so wonderfully presented that I thought you guys would be the experts, since you deal with that, you are with people at the end of life, which so naturally a lot of these questions come up. And it's hard, and it's not real black and white sometimes. And so what I was struck with in that presentation was, you know, anybody can fill out a form. You just fill in the blanks and check where you want and don't check where you don't want. But one of the things that we talked about was how important it is to talk to your family and your healthcare provider, your doctors, your specialists, all that kind of stuff about those wishes. Talk a little bit about that.
Well, unfortunately, by the time someone comes to hospice, they're already in a healthcare crisis. And oftentimes we see the pitfalls of when people don't do advanced directives or when they do them inappropriately. So, because we see all of that, we want to educate people before they get into a healthcare crisis and talk about what are some things you can do to prevent problems and how to fill out the paperwork correctly. As you said, anyone can fill out a name and sign your signature on a form, but it's so much more than that. It is the conversation. It's about talking to people. You don't just put someone down because you think, well, I should put my spouse down or I should put my oldest son down. It needs to be someone who can make those tough medical decisions for you. It needs to be a discussion. You don't just put someone's name down and say, okay, you're going to make these decisions for me, without talking to them about what your values are. What is it that you want done? If you were in this situation, what would you do? If you were in that situation, what would you do? It's all about having discussions with people, and then making sure that once you share your wishes, your values, making sure that the person that you're naming is willing to do that. Some people just cannot do that. If you say, I don't want to be on life support, I want you to make the decision to stop the life support, and your daughter says to you, Mom, I can't do that. I can't emotionally do that. Then you know what? She's not the right person to name. You need to find someone else.
And that was actually one of the examples that we talked about was And I've never really heard anybody say this, but maybe you don't want your children to be your decision maker because they are so emotional about your health care that maybe they can't do what you want them to do,
Right.
whether it's to keep you on life support or stop or whatever it might be. The emotions are a little bit too high for family members, and so some people might think of a sibling or a very long time family friend or whoever.
Right.
Can a person name anybody they want?
Absolutely.
Okay.
Yep, you can name anybody you want. So it does not have to be your next of kin, your oldest child. It doesn't have to be anyone related to you. It needs to be someone that you trust, who you know, who understands you, and will make the decisions that you want to make. So anyone at all can be named.
So more of the criteria is a person who knows what your wishes are and can follow through on those than
Correct.
necessarily who's named in your will or anything like that. It's
Right.
who can
Right.
help
Yes,
you
and this person does not take over anything with finances, has nothing to do with the will. You can name a separate person for the executor of your will. You can name a separate person for a financial power of attorney. It does not have to be the same person across the board. And oftentimes it's wise not to have the same person.
Right. And once you fill these out, does that person then have that healthcare power over another person?
No, a lot of people get confused by that. A healthcare power of attorney only comes into effect when you're not able to make your own decisions. So we encourage everyone at the age of 18 and over should have advanced directives in place. And I know that may sound kind of silly because when you're 18, you're young, you're healthy, you know.
Not thinking about end of life.
Right, right. But look at the news, you know, just in the last week there's been tornadoes, devastating things that have been happening, things around the world that are happening, and you never know when something's going to happen to you. A car accident, a freak thing. And you want to have things laid out to make it easier for your family to make those decisions. By the time you're 18, you have a good sense of what you want. You have a good sense of your values, your beliefs. It's important to put those down in writing so that your family can have less of a struggle making decisions. If they know they're doing what you want, it's so much less of a burden for them.
Right. Now, let's say between the age of 18 and 42 or whatever, you change your mind and you get married, and so you want to name your spouse, or you change your mind and you do want something or you don't want something. How does a person
That's the
change
nice
them?
thing about advanced directives is you can change them as many times as you want. And often as we get older, we are going to want to change them. Our stage in life is going to be different. The people around us are going to be different. Sometimes our values and our beliefs change. Also, the healthcare issues that we face change. For myself, as a younger, healthier person, my advanced directives are pretty easy, pretty clear. But if I suddenly face an illness, a chronic illness, or even a terminal illness, my wishes may change depending on what that illness is and the circumstances surrounding that illness. So at any time you can change your advanced directives. All you have to do is fill out new ones. It goes by the date, so you make sure that you date it, and whichever one is the newest date is the one that's in effect. And that's all you need to do.
And so that kind of begs the question, who all do you give copies to? Because if all you have to do to change them is do new ones, then you have to go back and collect and get rid of all the old ones.
You want to make sure that you have a copy. You want to make sure you give a copy to the agent that you designate. So the person who's going to make the decisions for you needs to have a copy.
Okay.
It's also wise to give your physician a copy and your local hospital a copy.
Okay. And I know from a hospital standpoint, people always say, I was just in here, a month ago or a year ago, and I gave you my advanced directives. Why are you asking me again? And it's because
they could change.
They could change.
Absolutely.
People get divorced, people pass away, people's wishes change, and we never want to assume that what you said before, that would be bad. So that's why they always ask. How do you recommend to people to start that conversation? Because, like I said, the form is the easy part, believe it or not. But the conversation with family or even a healthcare provider can sometimes be messy or uncomfortable. How do you recommend people start that?
It can be a difficult decision. Nobody wants to talk about death. Nobody wants to talk about the what ifs. But it's very important that we do. As medical technology continues to advance, we're finding people in stranger predicaments than we've ever seen before.
Right.
And there has to come a point where the family family and the patient take charge and say, this is what I wanted, this is not what I wanted. So having the conversation can be very difficult, but it's an important one.
It really is.
So whenever I'm working with a family with advanced directives and they say, okay, I want to name this person, I will say, have you talked with them? Have you? And if they say no, I really try to postpone finishing the advanced directives and having the conversation with the person. And it is difficult, but it is so worthwhile. And you have to look at, you are doing a favor to your family,
Huge favor.
to your friends, whoever it is that you're naming. If the more information you can give them, the more you can talk about, this is what I believe, this is what I don't believe, this is what I want, this is what I don't want, different things like that. It's going to make making the decision so much easier. It's going to relieve that burden. And then also, everybody experiences grief after a death. And grief is often compounded with guilt. And a lot of people have a lot of guilt having to make these big decisions for someone else. You can relieve that burden and relieve that guilt by having explicit conversations with someone that you trust that to carry out those decisions for you.
Okay. And what with families who have large families or small families, lots of kids, and so you don't just necessarily want to talk to, if you do name a child, you don't necessarily just want to talk to that child. You kind of want to talk to all the children, so there's no surprises. You're already going to be in a crisis situation probably, and nobody wants a surprise on top of that.
You want to talk to all the people closest to you. So you want to talk, obviously, one, to your agent, the person you're going to name to make those decisions, and you're going to want to make sure they're comfortable, that they align with your belief system, and that you feel comfortable that they're going to be able to handle this burden. But you also want to talk with everyone else who might be involved within your family circle. So that would include any close friends, close relatives in your immediate family. You don't want to have any surprises. So it's important for them to know exactly everything that your agent knows, because they can be a support to your agent. They can say to your agent, you know what, Mom told me this is what she wanted. I'm so glad you were able to do it, because I don't know that I could, but I know you're doing what Mom wanted, and give that person extra support. Oftentimes at end of life, families are torn, families are split, and it didn't have to be that way if there were firm conversations ahead of time.
If people know what the wishes are, what the expectations are, even like you said, it's an uncomfortable conversation. I don't want to have that conversation with anyone, but I sure don't want to have the situation happen that usually does if you don't have that conversation up front. So
what happens is, it may be uncomfortable now, but I can tell you from the other end of the spectrum that families that come to us that didn't have the conversation regret and say, I wish I would have had the nerve to have that conversation, because now it's so much worse. The conversation is so much easier than not having it.
Yeah, and that's why you're here, because you have the blessing of hindsight of working with a lot of families who have and who haven't done them, and so you can see the pros and cons of both ways, and you can kind of share that with us, and that's why you're here. But right now we're going to take a quick break, and we're going to come right back and finish up talking about advanced directives. Talking about advanced directives with Joanne from Stein Hospice, and we spent a good portion of the first half talking about the conversation, because truly that is the most important part, is having that conversation with your family, friends, whoever that might be, as well as your healthcare provider. Similar conversation with them, so they understand your wishes, because they're very likely going to be following your care, and so they need to know that stuff too. Let's talk a little bit about the 3 different kinds of documents that we've been talking about. The healthcare power of attorney is the one you said where you name somebody to make your decisions if you can't. Living will is where you outline what you do and don't want, and then there's a do not resuscitate. So talk a little bit about the actual forms that people fill out. They have to initial things in there and sign and witness and all that.
Okay, so a lot of people do get confused with the 3 different forms. So let's first start with a healthcare power of attorney. So that's simply where you name an agent to make healthcare decisions for you if you're unable to. Okay. So, and that could be any kind of a healthcare decision. It could be that you're unconscious and maybe they want to start a new type of treatment on you. So they need consent for that, or there's testing they want to run on you, and so that person would make those types of decisions for you. Okay. It could also get to be more severe, where you're making life decisions. Someone's on a ventilator. Do we remove the ventilator? Do we keep the ventilator? It could go to that capacity, but it could be something very small.
Do they also have an opportunity, I think, in there to name an alternate?
Yes, yes. You do name your first choice, and then you name an alternate. So if the first person passes away or is unavailable, you have an alternate that you can go to be accessible. You can put in your healthcare power of attorney whether you want food and hydration. So if you're in a permanent vegetative state, you can put in there whether you want hydration at the end of life. And that's a personal decision to make. And we're seeing more and more as the younger generation is aging and they're more proactive within their health care. They are customizing their healthcare power of attorney. They're writing specific things in there that they want or they don't want, and you have every right to do that. So the more educated people are becoming, the more they're writing in their healthcare power of attorney specific things. Then there's the living will. The living will is an important document to have. This document specifically talks about when you're in a permanent vegetative state and on life support systems. So this does not come into play if you're unconscious and not able to make decisions for yourself. It only comes into play if you're terminal and in a vegetative state. And this one gives the agent who you name the power to make the life decisions, whether to take off the vent, whether to stop food and hydration, and again, you can customize this one as well.
And that the I know the part 2 initial about the artificial nutrition and hydration if you're in a permanently vegetative state. That's in both documents.
That is in both.
And then the living will is also more end of life. It's not just I'm unconscious or I've had a stroke and I can't.
I'm agreeing to a test.
Right. Okay, so that's more end of life kind of stuff.
And both of those documents, the healthcare power of attorney and the living will, you can do yourself. You do not need an attorney. You can do them yourself. You just fill in your name, your two alternate, your first agent and an alternate, and then you sign it. And you need 2 witnesses that are not related to you. Or you need to have a notary.
So either or. So you could just have a neighbor or whoever witnessed it, or a notary.
Or you could find.
Is there somewhere in there where physicians are not allowed to be named, or nursing home administrators or something?
Yes.
Unless they're a family member. Unless your family member happens to be
You don't want anyone who's associated with you in a way for your healthcare decisions. So you want to have a non-biased person to be your witness. Yeah. And then the third document is your do not resuscitate. Now this you cannot do yourself. This is actually a physician's order. So this is a discussion that you're going to want to have with your physician. So in the state of Ohio, the law is that you can have 3 different code status. Your first being a full code, which most of us are full codes. We're walking around, we're healthy people. If we suddenly collapsed and our heart stopped, we would want CPR, we would want everything done to try to revive us. So we're full codes. People with chronic illnesses, people that are elderly, end of life, terminal illnesses, may choose a code status of a DNR, a do not resuscitate. And there's 2 different options. One is a DNR CCA, and a DNR CCA is a do not resuscitate comfort care arrest. So that means they're going to do full resuscitation on you, but when your heart stops, then they're going to stop. And then a DNR CC is your other option, which is just a do not resuscitate comfort care. And with that, we're just going to keep you comfortable. Now, whenever time we talk about a do not resuscitate, people get very anxious about that because do not is a very harsh kind of a word. It seems like we're going to do nothing for you, and that's not the case. We're going to do everything possible to keep you comfortable. We're going to give you pain meds. We're going to do different things to keep you comfortable. We're just not going to do the resuscitative part.
And so if somebody has, we talked about this in the program that I went to, if somebody has a Do Not Resuscitate comfort care, but they get a urinary tract infection or they get they break a bone or something like
Right.
that. They're going to treat
They're gonna
that
get
because you
treatment
need
for
to be
that.
kept comfortable.
Correct.
But in terms of being very aggressive with lots of testing and surgeries and that kind of stuff, maybe not necessarily the case based
Right.
on.
Well, actually, a DNR really is only about when you go into cardiac arrest.
Okay.
So it really has
Only
nothing
has
to do with any other healthcare decisions
Okay.
at all.
Only your heart and lungs if
right.
you stop.
But people do get confused, so that's
Okay.
a good point. People oftentimes don't want to sign a DNR because they're confused. They think if I sign this, then you're not going to do anything for me.
Gotcha.
That I release all my rights to any care, that you're just going to put
Gotcha.
me in a corner and you're just going to leave me alone, and that's not the
Okay.
intent of it. The intent is, do you want to be revived? Do you want that type of aggressive treatment?
Okay.
Anything up until your heart stops is all fair game.
Right.
And
Okay.
we're going to take care of a broken bone, we're going to take care of a
Right.
urinary tract infection, give antibiotics for a pneumonia. Of course, you're going to get all the standardized medical care that you would normally get.
Okay. So Do Not Resuscitate is just that. It's only about if your heart and lungs were to stop,
Right,
whether you
right,
want them, whether you want to
right.
be resuscitated or not. And I think that's good that it's a physician's order because
Yes.
that is really quite clinical. And so,
It needs to be a conversation with your physician and again with your healthcare agent
Yes.
and your family,
Yes.
making the decision of where are you in your prognosis, in your disease progression, and what is the prognosis,
Okay.
and where are you at, and these are the benefits, these are the risks of CPR,
Right.
and do the benefits outweigh the risks,
okay.
and making that
Making
decision.
that decision and again, talking to the healthcare provider, your family, the whole 9 yards.
Right.
So how do people get copies of a healthcare power of attorney, living will, Do Not Resuscitate, that kind of stuff?
They can go online. You can go online and just print copies. You could also go to Magruder Hospital and get copies of healthcare power of attorneys. Most healthcare agencies will have advanced directives available to the public as well as to their patients. And we at Stein Hospice, of course, have those documents for the community as well.
Okay. And you said a Do Not Resuscitate is a physician's order, so
Correct.
there's nothing necessarily that they need to pick up. It's something that the physician's
No,
office
that would be
have.
something that if you think that you need to have something like that, at your next physician visit, talk to your physician about that.
Okay. And you said filling them out, there's just a place for them to initial, if they would not want artificial nutrition and hydration, they sign either two witnesses or a notary, and that's
Correct.
pretty much all that's involved. And you talked a little bit about where do they keep copies, but just mention that briefly again.
Okay.
That
yeah.
you need to keep
you
it yourself.
You want to keep a copy for yourself. You want to give a copy to the agent that you name to make your decisions. Your physician should have a copy, and then your local hospital should have a copy.
you'll be asked.
And it's
Okay.
important too for some of our snowbirds that go to Florida maybe for the
Yeah.
winter, or Arizona, and you're going to be there 4, 5, 6 months out of the year. It's important that you bring those documents with you, and you have them at your physician down there and your local hospital down there as well.
Do they need different forms for different states, or?
Well, that would be something I would suggest that maybe you talk to an attorney about the different state laws. But in general, a healthcare power of attorney and a living will transport between states. That really isn't a problem. A DNR order, however, is only good in the state of Ohio.
Okay.
So if you're going to be down in Florida or Arizona or wherever you travel for long extended periods of time, I would suggest talking to your physician down there and seeing what they have. But the DNR is only for Ohio.
Okay.
If you're just going on a short trip, you're going to California to visit the grandkids or something, and you're going to be gone 2 weeks, I would just bring a copy of it with you.
Okay.
It'll probably suffice, but if you're going to be somewhere for a long period of time, I would check into that.
Okay. So you really want to keep it sort of with your medical cards. I remember somebody asking, is this something that we want to keep in a safe deposit box or something like that? And no, definitely not,
No.
because it needs to be accessible.
Right.
As accessible as your insurance cards.
Yes, and
or
I've
whatever.
had that happen many a times where people kept it in the safety deposit box, and we're in the hospital in a healthcare crisis, and nobody can get to the bank. The bank is closed. The person who's ill, who is the box owner, and so nobody can get into the box. So that's not a good
Not a
idea.
good place, okay.
It needs to be someplace where it's accessible, where people know where it is, and they
Okay.
can grab it. Because
Okay.
you never know when a healthcare situation is
Right.
going to occur.
Right. I want to spend just a couple of minutes. When I went to the program, they talked about, and you said as this younger generation is aging and technology is changing and our knowledge of healthcare is changing, people are sort of customizing their advanced directives, and we were talking before the show about, there's some people that say, keep me on life support until all my kids can come back and say their goodbyes, and then I don't want to be on life support anymore. Or, do you see lots of different scenarios like that, or people?
Yeah.
So you can outline that.
I've seen all kinds of things. Yeah, I've seen people talk about their pets, and they want their pet brought to them, and they want their pet with them before they die. Okay. I've seen people write specific things like, I don't want to be put in a nursing home, I don't want to die in a nursing home, or I don't want to die at home, or I definitely want to die at home, different things like that, or they name specific places where they would like to be. And so, especially with us at Stein Hospice, we make sure that the death, as much as possible, takes place where the patient wants it to be.
Okay, so you really can specify in there. And again, that might change over time.
Absolutely, it might change, and it may not happen. We're going to do the best we can, but things happen.
That's the other thing I always think about. You want to fill out the form and you want to talk to everybody, but you can never know what the situation, what the scenario is going to be. There are infinite scenarios that could happen. It's not necessarily going to be in your state, in your neighborhood. You could be anywhere. So that's why it's important to just have those conversations so they know, all right, this is the situation it happens to be. This is what they would want to do.
Yeah, if someone has a general sense of the decisions that you would make, and they know you, they know how you think, they know your philosophy, they know your culture, they know your religious beliefs, then that's what's going to arm them with making the best decisions. By just saying to someone, just pull the plug, if there's no hope, don't leave me lingering, that doesn't really tell me about your belief system. That doesn't really tell me what to do in those nuances where it's not just cut and dry.
So black and white.
Yeah, things aren't black and white, and they're going to continue to become more and more gray. So the more information, the more we can talk to people and let them know who we are and what we believe in, they're going to be able to make better decisions for us.
And that's what it's all about. What a great way to end it. Thank you. All right, we're going to take another break and we'll be right back. I want to thank Joanne for being on the show today. They have certainly seen a lot, and that's just a wonderful way to learn about advanced directives, the healthcare power of attorney, the living will, do not resuscitate. With technology and information changing all the time, it's kind of a gray topic, but it's so important, and really the bottom line is to have those conversations. Certainly fill out the forms and keep them in the right places and all that stuff, but really the most important thing is to have those sometimes difficult conversations with your family, with your healthcare provider. Just make that a priority, so that when something happens, none of us get out of this alive, so when something happens, it's not quite as difficult as it can be if we haven't had those conversations. So if you ever have feedback about a program or a suggestion for a future episode, let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Carla Pelz at the high school, cpelz@pccsd.net. So think about something that you learned today, some of this information. It's helpful information for all of us. Also share it with others, family and friends. And until we meet again, I encourage you to make time for health.